It's not like you're walking around and you're like, dang, I do have gum disease, something is hurting, right? Most of the time when you find out, or most people find out they have gum disease, they've gone to the dentist and they've been told, hey, you have gum disease. That's the problem, because it doesn't hurt. There's nothing that hurts, especially in the early stage. It doesn't hurt, doesn't do anything. You can go about your life, no big problems. And that's what ends up making a lot of people lose teeth that they could have saved, especially if we just intervened a lot sooner. I'm just here to talk about some of the signs and symptoms, or some of the things you may see that may be like, hey, maybe I need to get this checked out, and make sure that it's not a big deal. So before I get into some of the symptoms that you see, I just want to address what causes gum disease in the first place. So gum disease is caused by, let's say, I know everybody's brushing out there like they should, so I'm not going to say you're not brushing your teeth. I know you're all brushing your teeth. But what happens is sometimes there are areas that we generally miss when we brush. So it could be the very back of your mouth. Maybe if you have some wisdom teeth or something like that, maybe you're not reaching back there, or maybe back of your bottom teeth, maybe it's hard to reach in that area. So then what happens is you have plaque that stays on your teeth, and if it stays long enough, it gets hard and it turns into what's called tartar. And this tartar has bacteria. After it hits the gums, now they get swollen, inflamed. And what I try to make an analogy of is, it's like having a foreign object in your body. So let's say you went and you needed a kidney transplant, for example. Once you get a kidney transplant, you have to stay on these drugs, the anti-rejection drugs, because it's like, hey, you have this thing, it's not yours, your body wants to reject it. So basically about the same thing. You have this tartar in your mouth and your body is like, help, save me, there's something here, we gotta fight it. So then you get all this inflammation. So the first type, which is called gingivitis. And gingivitis basically is first stage gum disease. Great time to catch it if you have it, because it's still reversible. You can just get a regular cleaning at the dental office, you keep up at home, you're good. But what are some of the things you would notice if you had that? So you would have bleeding gums. So your gums are bleeding, especially when you're brushing and flossing. A lot of people that think that it's normal to have bleeding gums when they brush and floss. Maybe my toothbrush is a little hard because I like to brush hard and make sure things are clean. First of all, it's not normal. It's definitely not normal at all. Because think about it, if I touch your hand here instead of bleeding, you would freak out and be like, what's going on? I need to go to the ER. Same thing. If you're brushing your teeth, your gums are healthy. There should be no blood at all. So if you're seeing blood, something's going on, you need to go to your dentist, have them check it out, make sure everything is okay. So that's going to be one of the first things that you notice. But mainly you're going to have bleeding. You're going to have the bleeding, you're going to have the inflammation like we talked about, because your gums are going to be red and puffy. So healthy gums are going to be pink and firm, unless you're a darker skinned person. They could have a little bit of melanin in there, and that's completely normal, but they should just not be red, puffy, inflamed, and bleeding. So that's the first stage. And then now comes the second stage, which is the more serious stage. And I want to make sure that you stay with me so that you don't miss this, right? Because this one is more serious. It's not like the stage one where it's reversible. At this point, you're now in what's called periodontal disease. When you're periodontal disease, you have now started to lose bone that's holding your teeth. Your gums have started to shrink. So a lot of people will start to notice that their teeth look very long. It's not like all of a sudden you're 30 or 40 and your teeth are growing, right? They're not. It's just that the foundation is going away, and now the root surface of the tooth is now exposed, and now the tooth looks longer. So that's one of the signs. The other one with periodontal disease is that your breath smells really bad, and no matter what you do at home, it just doesn't cut it at all. And there are times that if you speak to somebody, whether it's in the dental office, whether it's out and about, you're like, man, they have that perio breath. And that's when it's advanced as well. The gums will still be inflamed, but those are some of the signs that differentiate the two, where with the early stage, you haven't started losing your foundation. Your foundation is still intact. And we can fix that. With the second stage, the foundation is crumbled. Now the question is, how crumbled is the foundation? Is the foundation crumbled enough to where we can go patch it up and maintain it where it is? Or is it too far gone to where now your teeth are getting loose? So if you start noticing your teeth are loose, that's a bad sign, because it means that bone is almost gone completely. And at this point, normally we can't really do anything about that. If you notice any of these signs, whether it's the bad breath, whether it's your teeth are looking longer, bleeding, all that stuff, I want you to go ahead and make an appointment, find a dentist you like, make an appointment, get seen, get checked out, because the sooner you catch it, the better. And if say that you're told that something is wrong, The sooner you treat it, the better it is, because it's never going to get better. It always gets worse. An infection always gets worse. It doesn't get better. It doesn't get cheaper, because initially maybe a deep cleaning is expensive, but it's going to be cheaper than getting all your teeth taken out. It's going to be cheaper than getting dentures, and also dentures are not great. And if you know anybody with dentures, or if you have dentures and you're being 100% honest, they're hard. Some people do well with them, but a lot of people don't do well with them. They're really hard to eat with. They're not going to be like your natural teeth. Our jaws move and everything, and so they're going to try to pop that thing out. It's going to affect the way you taste your food. And maybe even if you go the implant denture way, where you get implant supported dentures, still a bigger investment in money and stuff like that. So it doesn't get better, it just gets worse, and it gets more expensive, and ignoring it doesn't make it go away. Before I go, I just wanted to say that, hey, if you have any questions or anything that you want me to talk about next, any concerns or anything, just comment below. I read every single one of them, and I'll comment to every single comment. And if you want to learn more, or if you found this helpful, definitely subscribe. It will help other people find this information.